So welcome everyone. As some of you may know, we host experts in the field of psychology to learn more about their specialties in the psychology series of Bura Boğaziçi University Reunion Association. And we are honored to have Dr. Hooman Keshavarzi with us this evening. Thank you for accepting our invitation, Ustad. I'd like to start by mentioning his background so that we get to know more about him. Dr. Keshawarzi holds a doctorate of clinical psychology, a master's of clinical psychology, and a bachelor's of science, special psychology track in Islamic studies. He is currently an assistant professor at Ibn Khaldun University, adjunct professor at American Islamic College, Harvard Seminary, instructor of psychology at Islamic Online University, and founding director of Khalil Center, the first Islamically oriented professional community mental wellness center and largest provider of Muslim mental health care in North America. He is also a fellow at the Institute for Social Policy and Understanding at the Global Health Center, conducting research on topics related to Muslims and mental health. Hooman Keshavarzi is an international public speaker and a trainer currently serving as a clinical supervisor of graduate students of clinical psychology at the village of Hoffman Estates. He also delivers seminars on specialized topics around multiculturalism and psychology. In addition to his academic training, Hooman Keshavarzi has studied in Islamic theology in classical madrasa approach at Darul Qasim in Chicago, USA. His research interests include Islamic psychology, tasawwuf, spirituality, forensic psychology, Islamic jurisprudence, clinical mental health practice, community mental health care research, and process outcome clinical studies. And today we will listen to him on the issue of Islam and psychology. After his speech, we will have 15 minutes of Q&A session. Our audience can use the YouTube chat box to ask their questions during the event. Without further ado, let's get started. Dr. Keshawarzi, we are listening to you.
Thank you very much. Assalamu alaikum, everybody. Bismillahir Rahmanir Rahim. Alhamdulillahi wahda wa salatu wa salamu ala man la nabiyya ba'da. It's very nice to be with you all here virtually. I'm joining you all from the Uzbeki Tekke, Uzbekler Tekkesi in Üsküdar. So it's, I think, very appropriate for the topic and subject matter. We're looking at the modern emergence of an Islamic psychology discipline, and we're really drawing upon and attempting to draw upon the Islamic intellectual heritage. One of those buildings is sitting right in front of your eyes here in the Tekke, and also you're essentially living and witnessing many of these spaces in which your very own legacy is situated in, and we want to show how this can be taken from history, simply a historical fact, into some sort of modern application to inform our field, inform our work with Muslim patients if we're doing clinical work, our work in academia, and our work in psychology studies globally, inshallah. So that's the goal. I'm going to go ahead and share my screen with you so that we can discuss this topic. So we're going to look at this slide here. Do you see a presenter view, or you see just the slide?
We see the slide.
Okay, perfect. Okay, so first of all, what is the need, right? Let's talk about Islamic psychology or an Islamically integrated psychology and Islamically integrated psychotherapy. What's the need? And I'll just say this, my bias is that I'm a clinical psychologist, therefore you will see my focus being a little bit more on clinical as opposed to general or broader psychology. So I'm going to try to speak more broadly, but you will see a lot of mention of clinical psychology and clinical applications. So what's the need? I mean, first of all, oftentimes in modern day now, the world is looking at what the APA has to say, right? So APA is sort of our authenticating body and legitimatizing body. And in the 2016 APA president actually said, which was actually recorded in an article later, but at the conference, at the American Psychological Association conference, said that we need to start looking east to inform and enrich the field of psychology, that the horizons of psychology has grown and it's a globalized community, and using Eurocentric and cultural paradigms are no longer applicable for the diversity of the world. Shortly thereafterwards, in 2018, the APA has its first ever dialogue and panel on Islamic psychology, of which I was a presenter at that panel. They asked, we submitted an abstract and had a couple of us present. And then later on in 2019, which is a little bit more challenging to get into, at the American Psychiatric Association, not the Psychological Association, we ended up presenting also on a panel of Islamic psychology as well, both of them being just pre-pandemic, right? So there's a recognition that there's an underrepresentation of the Islamic intellectual heritage or scholarship. I think this was one of the burning questions that was in my mind when I was doing my undergraduate studies. I felt that there was a huge gap. I felt a sense of not being able to relate or identify with all of the individuals that are being presented. These are all individuals that are coming from the European world with the names and histories and backgrounds that match their experiences. And I wondered what was going on in the Muslim world. Not to mention the fact that we had this huge gap, as many psychology students probably notice. We go from the ancient Greeks, there's this huge dark ages, and then we jump into the Renaissance, and then we jump into the 19th and 20th century is when we really talk about when psychology begins. Psychology recognizes that there is a lot of norming issues in the Western world. There's so much of an emphasis on cultural psychology and indigenous psychology movements, and the recognition that psychological instruments have been normed mostly on Western populations, and they're not necessarily as generalizable, and they usually put disclaimers on usage with other populations. The other piece is that we find that in the DSM, for example, not everything in the DSM, even though it's a diagnostic and statistical manual of mental disorders, not everything is of the same status, right, in terms of its empirical basis. There is a recognition, especially in the DSM-5, right, that, for example, something like, or in DSM-4, this was mentioned, but now it's not mentioned in DSM-5, that, for example, anorexia nervosa has been conceptualized as a culture-bound syndrome specific to industrialized countries and is really not found in other places. If we take the common diagnostics of depression, how common is that, right? I mean, that's one of the main, after anxiety, it's the second most diagnosed clinical condition. And what is the inter-rater reliability of depression? It's 0.28. The Cohen's D is a 0.28. It's a very low effect. Now, that's not to say that I'm throwing out all of these diagnostic categories. And certainly there are other things that are much better. When we look at trauma, for example, we're looking at 0.8 and beyond. So there's a lot of reliability there. But I want us to really start to think about and question this notion that we often conflate or associate everything with DSM and everything that comes out of quote unquote empiricism or empirically validated modalities. And we assume them to be automatically certain and scientific and fact, right? And there's a difference between hard facts and there's a difference between soft facts, and there's a big gray area in between. And I want to sort of talk a little bit about this. Another thing that we see is the absence of lovesickness, right? For example, in the Islamic literature, you find this notion of lovesickness, ishq hastasa, right? That you see this in the Islamic literature a lot. And physicians used to diagnose and treat lovesickness. If we look at the DSM criteria today, certainly love can be a sickness, passionate love. Individuals are in love. Let's look at universities or high schools. What do? They're fighting with their parents. They can't concentrate on school. Their appetite may be constricted. They're staying up at night all day. They're, zoning out into their minds, right? And so many of these factors are definitely impacting them, but why isn't it included? Because it's a socially acceptable, not only acceptable, but also seen as a normal milestone that everybody wants to fall in love in the West, right? Everybody sees this as a normal milestone that every adolescent is going to fall in love with somebody of the opposite gender, and that's okay, right? And that's and so this is kind of just bringing into question some of these things. I'm going to jump to help-seeking behaviors. This is just building the need. We find that among Muslims specifically, right, at least in the US, where I do a lot of my clinical work and our institution is based, we find that Muslims are reluctant to go to mainstream psychological treatment settings, right? They're very underrepresented in treatment settings. They're likely to avoid seeking psychotherapy unless the therapist provide it within a spiritual context. And in 2010, a survey of Muslims found that they wanted two competencies in their therapists. They didn't necessarily want to go to a hoja. They didn't want to go to a hoja only. They also didn't want to go to a secular psychotherapist, but they wanted somebody who would effectively integrate spirituality, but not only just be a Muslim. They didn't want just the Muslim. They wanted somebody who would integrate spirituality into the treatment process. So it just goes to show that there might be a gap between what we are doing, right, as psychologists, and the way that we are trained, and really the needs or what the patients are wanting from us. Here is a study that we did of our own population at the Khalil Center. We're the largest provider of Muslim mental health services across the country. Across North America, we serve over 10,000 Muslim patients a year. And we have, like 30 plus 40, therapists, psychologists, psychiatrists, social workers, marriage and family therapists. And we asked these questions of our clients. And we found, first of all, before I ask and get to this, 75% of our patients had never sought psychological services before coming to our center. We asked them, why did you come here? And we look at the results. How important is it that your therapist shares your religious values? We find that it's extremely important or somewhat important. Then we look at how important is it that religion, spirituality is an essential part of the therapy process. And we have the 97% say it's either somewhat important or extremely important. And we can see that the overwhelming bulk of the population is coming to us because of spiritual integration. Had we not existed, these people would go undiagnosed and untreated. And we're talking about a large percentage of the Muslim population that is coming in the US to a treatment center like ours that would never go elsewhere. So what do we need then? We need a model, an effective model of an Islamic psychology. A model that doesn't necessarily throw out psychology, but how do Muslims position themselves in a way to be able to draw upon their Islamic intellectual heritage, but also what is the position and approach they take to modern Western psychology so that they can have a reconciliation between these two worlds that oftentimes don't communicate, right? They sort of live in two different spaces. I talk to a lot of my students here in Turkey, for example, and even in the US, psychologists that are trainees, and they say, okay, well, I ask them, how do you cope with psychological problems? When you feel distress, what do? Hocam, dua, zikir, ibadet, sabr, şükür, istişare. And then I said, okay, what happened to CBT and chair work and narrative therapy? And onlar aklına gelmiyor. The first things that come to your mind are these concepts usually, right? Oftentimes for religiously adherent people. And that's how most Muslims, studies show, cope. And so how do we change this multiple personality notion of the psychologist that's a Muslim, that you walk in the room and you have to check your values at the door and walk into the therapy room and be a secular psychologist. Meanwhile, outside of the psychology room, you are somebody a little bit different than that. And so we want to have these two worlds really converse with one another. So what is TIIP? We came up with this model, and it's called the traditional Islamically integrated psychology or psychotherapy. And it's really a structured articulation of an emerging Islamic orientation to psychotherapy. TIIP is an integrative model of mental health care that is grounded in the core principles of Islam while drawing upon empirical truths in psychology. So we utilize an Islamic epistemological and ontological framework to answer some core questions about human psychology. What is the nature of the human being? What is the psyche, human psyche? What are the drives of the human being? What is the health, the pathology, mechanisms of change, and principles of healing? All schools of psychology seek to answer these questions. And mind you, the initial assumptions that precede empirical methods are all theoretical, all right? So each of them, as I like to say, come in with a theology of psychology, right? And I'm using that word intentionally. So Freud has assumptions about the drives of the human being and their drive theory. Humanistic psychologist Rogers, for example, has a particular assumption about the human being, that the human being is inherently good, right? And that the values are all relative to each person situated within postmodernism. These are not empirical facts, right? Or behaviors that say there's a blank slate, right? And that the human being comes in as a product of reward and punishment. These are not empirical fact. These are theories and assumptions about the human being. But these assumptions inform the way that they will study the human being. And what I'm saying is that we need to have our own analysis of the assumptions of the human being that is consistent with our tradition. And I want to illustrate that. So what are those assumptions? Well, first off, we start off with, how do we understand what is truth? How do we understand what is true knowledge in psychology? This is epistemology, right? So when we look at psychology or human psychology, according to Islam, we have three sources of knowledge, right? In the Quran, right, Allah Ta'ala says, إِنَّ فِي خَلْقِ السَّمَاوَاتِ وَالْأَرْضِ وَاخْتِلَافِ اللَّيْلِ وَالنَّهَارِ لَآيَاتٌ لِأُولِي الْأَلْبَابِ. In the creation of the heavens and the earth and the changing of the night and the day are what? Ayat لِأُولِي الْألْبَابِ. These are ayat. Just like an ayah of the Quran, they are sources of information to give us knowledge about the reality of the world and the reality of the human being. So this gives us, Quran is telling us that empirical knowledge is a valid ayah or source of understanding truth, of understanding some bit of information. The Quran also provides, and Hadith provides, knowledge about the human being. For example, كُلُّ مَوْلُودٍ يُولَدُ عَلَى الْفِطْرَةِ, that every person is born on a good disposition of the fitrah. This is theology, wahi, scripture that is informing our assumption about the human being. Then we have rational sources of knowledge, right? Every human being, every living being, we have this sort of mantiq and rational reasoning, and every human being they arrive at al-hayawanu, al-insan is al-hayawanu natiq, that a human being is a a thinking, speaking, rational being. So they say there is a distinction of what makes human beings different than animals, and this is reasoning about the human being, right? And all of these are graded according to the strength of their information providing power. So empirical knowledge can be qat'i or it can be zanni. It can be certain or it can be conjectural knowledge. For example, if we're talking about correlational studies, that would be conjecture and speculation. But when we're talking about randomized control or experimental design, that is observed not through subjective self-report, by the way, right? Through hard science and observation. That is hard science and hard facts. And whenever we have a seeming contradiction, I say seeming contradiction between something that's found in one source and another, for example, Quran and empirical knowledge, then we can't just dismiss one of them and accept the other. We have to put them on the table and have a system of analyzing this information. And I'm not going to get into that because it's beyond the scope, but there's a methodology in the Islamic intellectual heritage as to how to sift and deal with these issues of seeming contradictions, right? So it gives us the capacity, in fact, it reconciles the faith and reason, this false dichotomy between science and faith is something that Muslims inherited from the Western European world. This is something that was consistent with their history. In order to enter the Renaissance, they needed to shed the cloak and the chains of the Dark Ages of the church that would put to trial people who were scientists. And they had their own scholastic theology, Christian Kalam Jalal. But they failed, and they ended up with positivism, and they ended up with the medical model, and now postmodernism, and so on and so forth. But ultimately, they arrive at this conflict between faith and reason. And Muslims never had this dichotomous problem. And I'll show you an illustration of that. So here is my proposed method of dealing with the subject matter of Islamic psychology, knowledge production. So how do we produce knowledge of psychology through an Islamic lens? First of all, what we need to do is to do a literature review of the Islamic scholarly tradition. Let's, as Muslims, look in our own tradition instead of starting with, St. Thomas Aquinas and Kant and Augustus and Galen and so on and so forth. Let's look at, and Freud and Rogers and whoever, let's look at our tradition. We look at our tradition and we understand our tradition. We can extract, I call this in Arabic, istikhraj, meaning we are taking out from the Islamic intellectual heritage and putting on the table all of the things that are related to human psychology. Then we want to do a literature review of contemporary psychology, right? And we want to critically analyze this contemporary psychology through our epistemological and ontological lens, and then we can bring them together as an integration. So we can look, does postmodernist assumptions align with Islamic thought? No, it's not qat'i, it's not certain knowledge, it's a theory. Okay, we can discard that. Okay, but is cognitive neuroscience something that's important? The empirical method, is it valid? Sure, we can adopt that. Okay, and I will demonstrate to you how Islamic scholars have done this in the past throughout the course of this lecture. So I position, how do we know how can we say that something is Islamic? How can we say that psychology is Islamic, or Islamic psychology, or Islamically integrated psychology? Anything, whenever we want to put a label of Islam on it, we have to have it situated or informed by the core Islamic sciences. What are the core Islamic sciences? It's fiqh. Al-fiqh al-akbar, So which is our aqidah, our kalam, our belief system. So this informs, how does this inform, for example, mental health and psychology? Through the lens of epistemology. It tells us this. This comes from our kalam tradition. This comes from our al-fiqh al-akbar tradition. Okay? Core assumptions about the reality of an akhirah and primordial assumptions about the human being. This comes from our belief system. What about fiqh al-zahir? This is our ethics, right? Our ethics of practice. For example, there's a hadith of the Prophet sallallahu alaihi wasallam, "Man tatabbaba fahuwa laysa alimun bil-tibbi fahuwa dhaminun." Whosoever practices medicine and they don't have knowledge of medicine and they make a mistake and harm the patient, then they are responsible to pay the cost of that. Okay? APA and malpractice insurance, we have all of these notions in modern psychology. Excuse me. But we have this discussion in the fiqh al-zahir. What else informs, is discussed in fiqh al-zahir? The issue of junoon, mental status, right? If an individual has a mental illness, is there any takhfif, hafif landirmek, right, of the ahkam of the sharia, of the rules of the sharia? Does he have to fast? Does he have to pray? Does he have to, is his shahada accepted? These are all rukhas. Their dispensations sometimes provided. For example, Ibn Abidin, as an example, gives an explanation that if an individual is experiencing woman is experiencing significant psychological distress, it is permissible for her to get an abortion. Okay? And so this is with regard to psychological distress. Right? And our tradition talks about this notion. Fiqh al-batin is Sufism, tasawwuf. It's our methods of tazkiyat al-nafs, of purifying the human behavior, cognition, and emotion. There is multiple methods in tasawwuf that perhaps converges most with the field of psychology and deals with the field of psychology most. I want to give you a practical demonstration of our TIIP approach, because I talked about it in theory. I want to give you an example of this methodology in action, okay? So look at, in TIIP, one of the principal assumptions about the human being and our methodology of treatment is to bring them to a state of i'tidal, of balance, right? Emotional balance, cognitive balance, spiritual balance, behavioral balance. These are the notions that we want to bring them to. Where did we get this idea of balance, right? How did we come up with this assumption? Well, let's take a look at, we took it from our Islamic intellectual heritage. Here's an example. This is Ibn Hazm in his Maratib al-Ulum, in his categories or classification of the different forms of knowledge. He talks about the knowledge of medicine. He said it is of two types. One is the bodily medicine, and the other one he calls tibb al-nafs, which today we will call clinical psychology. Okay, they used to call it tibb al-nafs or tibb al-ruhani, and then when they were talking about it philosophically, like Ibn Sina and Razi talks about philosophically about the human being and their psychology, they call it ilm al-nafs. Ilm al-nafs was philosophy about the human psyche. Tibb al-nafs is the practical application of that philosophy. Okay? And so he says, Tibb al-nafs وهو من نتيجة علم المنطق. He says, Tibb al-nafs, the science of psychology, is the result of reason, the science of reason. Where did we get it from? From rational sciences, not from wahi. Okay? So, where did they get it from? They got it from a lot of ancient Greek sources as well. They accept this notion. Ancient Greek, Unani Tib. They brought it from there, they critically analyzed it, and then they built upon it. Okay, so Yunani Tib is Western science, by the way. I want you to pay attention to this. So they adopted it because they said, we accept rational sciences. This is rational. We're going to bring it in. Then he says, well, sarfi. So what is the aim of Tibb al-Nafs? It is بإصلاح الأخلاق ومداوتها, to develop good character and its treatment, to reform the character of the human being and to treat it. وصرفها عن الإفراط والتقصير, and to remove it from its excess and deficiencies. وإقامتها على الاعتدال, and to create balance in the human being. Okay. Now I want you to look at Ghazali. Ghazali, this was Ibn Hazm's descriptive definition of Tibb, meaning he's not prescribing this, but he's giving a description of this is the field of medicine. This is the definition of clinical psychology. Now, Imam al-Ghazali, he's critical, but he employs a methodology of critically analyzing the philosophers and modern science, and then accepting what is useful, and then adding onto it scripture, analyzing it through scripture and revelation, and then giving you a holistic view on the issue. Okay? So he says, by the way, he's discussing in this issue, nature versus nurture problem. Is the human being capable of changing their character or not? That's what he's addressing. So he says, فَرَدُّ الْغَضَبِ وَالشَّهْوَةِ إِلَى حَدِّ الْإِعْتِدَالِ. It is necessary to return the disposition of anger and appetite to the boundaries of moderation. Do you see i'tidal? Moderation he's talking about. بحيث لا يقهر واحد منهما العقل ولا يغلبه بل يكون العقل هو الضابط لهما والغالب عليهما. So he is saying that actually we want the aql to be dominant over and to impose balance on anger and appetite. So we want balance, but the aql is going to be dominant in doing so. And then he says, ممكن, this is possible to achieve. وهو المراد بالتغيير الخلق فإنه ربما تستولي الشهوة على الإنسان بحيث لا يقوى عقله على دفعها عن الانبساط إلى الفواحش. وبالرياضة, and by spiritual exercises تعود إلى حد الاعتدال, by working on the nafs, you will bring it to moderation. And he says this is possible, and I want you to pay attention to this one ultimate chizyon. والتجربة والمشاهدة تدل على ذلك دلالة لا شك فيها. And experience, trial and error, and today we can say maybe even clinical trials or anecdotal evidence, and observation indicates upon this in such a way to provide us proof that cannot be negated. He is accepting it as a rational proof and as an observed proof. Empirical and rational, right? Sensory observation and also a rational reality. But then he says, what does the Sharia have to say about this? Three methods bringing together. والذي يدل على أن المطلوب هو الوسط في الأخلاق دون الطرفين أن السخاء خلق محمود شرعا. He is saying, and what other proof is there that in matters of character, having the middle path is praiseworthy and the intended. It is proven by this that generosity is a praiseworthy trait in the Sharia, and it is the moderation of excessive spending, wasting, and too little spending, jimrilik, okay, of being stingy. And then he gives Quran about it. والذين إذا أنفقوا لم يسرفوا ولم يقتروا وكان بين ذلك قواما. He's saying that, and those who spend, they do not do israf, and they do not do jimrilik, but rather they do in the middle. And then he brings other Quran and he brings hadith. خَيْرُ الْأُمُورِ أَوْسَطُهَا. The best of matters is the middle, is the path of moderation. So all of this I'm showing you as a process of living this methodology, right? And this is a good example for us today, and this is what we are doing with TIIP, is to draw from the Islamic intellectual heritage and to evaluate contemporary science through rational, empirical, and revelationary knowledge and bring it together as an integration. Now, who else talked about balance? The positive psychology movement. They caught up. They were onlar geri kalmıştılar. Batıcılar burada, bu konuda. Ahlaki konusunda geri kalmıştılar. Şimdi gelişmişler. Character, strengths, and virtues. So look at this. Wisdom, courage, humanity, transcendence, justice, and moderation. Bunların dördü, wisdom, courage, justice, and moderation, dördü Ghazali'den geliyor. Tamam mı? Wisdom, he says, four ana traits, ahlaki traits are hikmah, shuja'a, which is courage, adala, which is justice, and iffa, of moderation. He says moderation is the balance of shahwat, okay, iffat, moderation, and then courage, shuja'a, is the balance of anger, and wisdom is the application of knowing truth, aql, using aql to realize truth, and justice is using it in order to manage the system of ghadab and shahwa. That's what he says it is. But you can see there's a whole book of character, strengths, and virtues written by Peterson and Seligman, in which they also discuss, by the way, Islamic scholars' work on the issue of ahlak. Other example I want to show you is the richness of the Islamic intellectual heritage with regard to a singular topic on the issue of psychology, aql, cognition. Okay, there's a diversity in our tradition. When they talk about aql, you have various different fields within our tradition. You have physicians like Abu Zayd al-Balkhi, who talks about it as a medicinal treatment of imbalance. If you have too much negativity, you need to combat it with positivity. Okay, you have to develop positive thoughts in order to develop resiliency against negative thoughts in the future. Dayanma gücünü güç veriyor. Okay, and that's Abu Zayd al-Balkhi is talking about this. Razi talks about this. That's what using aql gives you the capacity to do. What about philosophers? Philosophers talk about it in a very philosophical way. They say, what is the nature of aql? Is it metaphysical? Is it physical, mind and body problem? They're saying, is it a material? Maddesi var mıdır? Ya tamamen metafizik bir şeydir. Yeah, it's a completely no physicality to it. And they discuss this issue. And then, was it created? Was it not created? Right? They discuss these issues. Kelamcılar ne konuşuyorlar? What do they discuss? They say aql's function is to give you nazari, necessary knowledge, and dururi knowledge. And that you are not a blank slate, but Maturidis, for example, say you are born with a capacity to see good, husn al-qubur, to be able to understand good from wrong. You are not a blank slate, you have a predisposed, inherited disposition to see truth. Fuqaha, what do they talk about? Fiqhçılar, they talk about responsibility and liability. Are you responsible? Do you have aql or do you not have aql? Ya akılsız mısın? Akıllı mı birisin? Not like the way we use in Turkish, but you know, do you have the capacity for reasoning? Then we have tasawwuf that talks about using aql to restrain nafs. They talk about the restraining quality of aql. You can see the rich tradition of discussing the function of human reasoning in the Islamic intellectual heritage. And we have written a book on this notion. of bringing these methods together in order to create a methodology for the application of Islamic psychology. One thing I want to discuss, and I'll finish on this, is that, well, how do we deal with the issue of empiricism? Well, first of all, there is RCTs, randomized control studies, to show that a Muslim version, have you ever heard of RCT? RCT is religious CBT, and they have a Muslim version of it. It's manualized. So they use Quran and Hadith in there, okay? They're not Muslim, right? They use this, but they're using a CBT paradigm. Koenig has worked with Muslims and has used this for 12 weeks to show that it is an RCBT approach, an RCT, randomized control, evidence for the treatment of depression, okay? And that 3 months later, the effects hold. Okay, but you say, okay, hocam, that is CBT, tamam, CBT, but we made it Islamicized. What about just purely Islamic methods? Is there any sort of proof? First of all, I will say RCTs are not fully developed for purely spiritually oriented psychotherapies. It's developing. Okay, that's first thing. Second thing, however, is that we have indirect studies, not direct outcome study, but we have the idea that faith and religion serves as a positive religious coping mechanism and positive protective variable. We have ideas that meaning making is an integral part of mediating psychological distress. We have overwhelming evidence for optimism, for gratitude, forgiveness, the negative effects of materialism, the positive effects of generativity and selflessness, the positive protective effects of religious engagement and involvement. All of this data together gives you clear evidence, empirical evidence, for the fact that the things we are drawing from in spiritual integrated methods are empirically validated. Now, you'll say, okay hocam ama yine de yetmiyor yani. Bir outcome study verir misiniz bize? Okay, CBT gibi. Okay, first of all, I'll say, well, I'll come to this point in a second, but I'm going to say we have a 1-year study on this methodology of TIIP. We did it at Khalil Center. We had 107 patients. We are part of a 23-site consortium through the Brigham Young University, in which was sponsored by Templeton University. 2, we did 400 sessions with 107 patients. Here are some, we didn't publish this yet. I'm just leaking some of this data to you. So here is psychological distress from session 1 into session 6, we see a decline using an Islamic psychotherapy. We look at functional distress, goes down on session by session 6. And these are statistically significant methods. Last thing I will say is this. We need not be obsessive over RCT. We have to embrace the fact that empirical methodology is very broad. The APA 2006 report counts all of these methodologies as empirically acceptable. This includes meta-analyses, process outcome studies, and also there's critique that RCTs do not mimic real life experiences. They're too controlled. Nobody utilizes a manualized, pure manualized approach in an artificial experimental design in the real practice. So that's why there is practice-based evidence methods that are coming about. And they are adding diversity to this discussion. Lastly, last thing I'll say, I'm going to stop here, is that we should not be so positivist that we should assume that we have to prove everything spiritual through an empirical methodology. Remember our epistemology. We believe in revelation. We believe in things that are beyond study as well. So somebody might say, okay, there's 2 approaches to spiritual approaches. One approach is, you don't have to be Muslim. This side. Ya gavur olabilirsin, atheist olabilirsiniz, ne olursanız olabilirsiniz. Tamam mı? Ama burada ancak söylüyorlar ki, tamam, spiritual integration yani It's a method of cognitive and emotional therapy, culturally sensitive approach. Tamam, bir gavur mesela Shakespeare kullanıyor. Başkası Kur'an ayeti söylüyor. Ama the goal is to change their cognition and their emotion. You don't have to be Muslim to accept this possibility, right? They say, okay, I accept it. You can use religion because it's effective, right? But we don't want to just be in this pathway. The other is we believe that there's a metaphysical soul, which means that there's a barakah and a spiritual connection, and there's a phase and that is coming with a connection with Allah Ta'ala. Dua isn't changing your life because you're doing cognitive reformation with dua. It's also a possibility, but it's a secondary benefit. Dua is changing your life because Allah is accepting it and then giving you that tawfiq, right? And so that's why as Muslims, we have to be very conscious of the fact that we cannot simply resort to a reductionistic methodology and attempt to make ourselves acceptable in the mainstream. We will do that with empirical methods, no problem with that, but we shouldn't do it to an exclusionary element. Kendimizi unutmayalım. Yani kendi metodlarımızı, kendi dinimizi, amaçlarımızı tamamen unutmayalım bu amaçların peşinde olunca. Tamam, burada bitiriyorum. I was going to put this, if I have time, I put this on the note, which was to discuss developing the field. How can we further develop the field? But I just wanted to show you, this is our Khalil Center. This is the different branches we have. We also have a Khalil School of Islamic Psychology. And also at Ibn Khaldun, we're working on Islamic psychology topics as well. And we're creating bir hareket, movements, İslam psikoloji, Islamic psikoloji bir movement, ekol oluşturuyoruz, geliştiriyoruz elhamdülillah Türkiye'de. Türkiye tekrar bir öne çıkacak. Yani İstanbul ekolu çıkacak. Yayacağız bunu inşallah. Allah'ın izniyle. With the tawfiq of Allah Ta'ala. Ve ahiru da'wana elhamdülillahi rabbil alemin. Tamam, burada da soru cevap kısmına geçebiliriz.
Hocam, thank you for this great presentation. I listened to you giving introductory seminars several times, but every time I listen to you, I learn new things, and this is so great. Like you reminded us that the diagnosis may differ substantially. What they say in an industrialized state and what you have in other cultures may differ. And you mentioned that Muslims in the USA want to go to a therapist which is competent in both sides, in both the religion and the science of this job. And I think this is becoming something in Turkey too, because you know that it's a new job in Turkey, being a psychotherapist. It's a new thing, and people become more aware of it by time, inshallah. And as stated, it's important to not to forget that Muslims have a fundamental coping mechanisms, which is their belief systems, and we may usually overlook this concept in studying psychology as a science. And the way you emphasized the main epistemological differences was very beneficial. I think not least but most important thing. And you said that this is a fake discrepancy, like what you have between religious knowledge and empirical knowledge. This is a fake discrepancy that be important from Western cultures. This was not our dilemma. And also you gave us an introduction to the Muslim scholars' understanding of psychology and clinical psychology, which is built upon both Yunani tip and Islamic knowledge, which they like proves that they had this balance between two knowledge or one knowledge. There is no two knowledge. and thank you for this comparative presentation. I personally learned a lot. So we had one question. Maybe you were speaking so openly and they had no questions in their mind. I don't know. It was wonderful. Thank you. One of our participants asked that what is the difference between psyche and nafs, or is they same in TIP?
Mhm. So psyche is, so this is a longer discussion, but in general, we can say that the human being has a body, and then there's something else that's metaphysical, okay? And the brain is part of the body, okay? Think of it that way. But there's something metaphysical that controls the brain, the executive functioning of the executive functioning. You know, the prefrontal cortex, your executive functioning, but the ultimate executive functioning. And in this, we can call it nafs. When we call it nafs, it has a particular meaning. When we call it ruh, we have a particular meaning. When we have aql, it has a particular meaning. Qalb, but it's one reality. It's like your body is one thing, but you have an arm, you have a leg, you have a tongue, you have a brain. They have different functions, different expressions, right? And aql, for example, serves as a cognitive basis. And nafs is a little bit of a longer discussion, but sometimes people refer to nafs as just generally the psyche of the human being, just the nafs al-insan, the actual person. What is the person? And then sometimes in Sufism particularly, they refer to it as the part of the person that is developing through stages. It's the underdeveloped part. It has this appetite and ego and anger, and it inclines towards animalistic behaviors, and we need to train it in order to make it trained, and we use the aql to train this lower part of ourselves in order to have balance, right? Like we talked about the balance across all of these things.
Thank you, John. We have more questions now. I want to ask them to you too. What can we do as guidance and psychological counseling students? Do you have any advice?
Advice? Yes. So my suggestion would be to really brush up on your Islamic studies as well. Try to be an avid learner, not only Islamic studies, obviously, but try to find ways of being able to connect with people who are specialists in this field. Join some of the Khalil Center trainings, some of the Ibn Khaldun trainings when we open them up to the general public. In particular, Adab is a wonderful institute, Adab and Isar, where they give you a classical Islamic education and appreciation. We've been studying Western psychology for 10 years of our lives. And then what about the other side? We're going to start in Islamic psychology with what? A weekend Quran course or summer Quran course. It's insufficient, you see. If we don't even know the language of Quran, right? How are we going to really make this integration? Therefore, it's important to get involved, but don't be intimidated. You don't have to study to become a hoja and get ijaza, and no, but you have to study enough to have some strong foundations. That would be my general recommendation. And our tradition is built on isnad and on sanad and sohbah. So find individuals whom you can connect with that know this field, and try to learn from them, and work under their mentorship, inshallah.
Like you, John. Inshallah.
Well, there's others out there. I'm not offering myself as
no, John, you should. Okay. What about psychological diseases and disorders? How does TIIP defines them? Is it same as DSM?
Yeah, so TIIP takes a very diverse approach to it. So on the one spectrum, you have clinical disorders. First of all, there's two categories, general categories. One is the diagnoses that are in the body, and then diagnoses that are in the psyche, metaphysical. The ones in the body, by the way, modern psychology confuses both of these together. The ones in the body are things like schizophrenia, psychotic disorders, bipolar, okay, some ADHDs, autism spectrum. These are neurochemical, they're genetic predisposition usually, okay? And generally they need a psychiatric and medicinal approach. Psychotherapy will help, but it's adjunctive and supportive. Okay, you have to have medicinal approaches. Okay, bunların dışında, okay, let's put this away. This one is psyche, in the psyche. By psyche, I mean metaphysical. I believe when we're working on psychology, we're working on metaphysical, okay? And how do we look at it? We have clinical disorders, which is functional, right? Through like DSM definitions of functioning. Person, work, school, family life, they can't function. Once they pass that stage, there's also spiritual dysfunction. Okay, for example, a person who doesn't have narcissistic personality disorder, but he is narcissistic, kibir. Okay, is this person a healthy person? Islamic Psychology'de öyle bir şey söyleyebilir miyiz? Yani bu healthy birisidir. Yok, söyleyemeyiz, right? If we're going to take a holistic approach. Then we have higher virtue development, right? We want to do higher virtue development. And that is tamam normal haline gelmiş. Normal birisi ama sonra bir evliyallah bir şey var, stage var. And that's living with higher ethics and living with higher degrees of resiliency. You say, okay, what is this tasawwufi model or something? No, actually, Seligman says the same thing, right? All of positive psychology is devoted to developing resiliency, having ibadat and shukr and meaning and husn zan and raja. These are all what? They took from Ghazali and all of these and they created a whole field. Today, batıdan gelirse o zaman biz kabul ediyoruz ama kendi mirasımızdan gelirse tamam şüphe ediyoruz.
Yes, hocam, unfortunately we have that bias.
Yeah.
And there's one more question.
Post-colonial trauma. PTS, what is it? Post-colonial trauma, PCT.
The last question is there a certain human model you accept to use in your therapy? Or what is your definition of a human being?
Oh, it's too long. You have to get involved in another lecture on the TIIP model. That's a whole lecture on its own, ontology, and then how we treat the psyche. But in essence, we take a Islamic framework in which we integrate aspects from different places. I don't call them CBT, even if it comes from CBT. Mesela Ghazali'de görürseniz, Ghazali mualicetül addadı almış şeylerden, felsefecilerden, tipçilerden. He never says, oh, this is Yunani intervention. Okay? He brings it, oh, it's true. Ya bu Western değil, Doğu Batı yoktur yani burada. It's real. It's true, it works, we take it, and then ama en önemlisi bizim çerçevemizin içerisinde olması. And that's the most important part. The most important part of TIIP is how you conceptualize your patient. Yeah.
Maybe we can learn that someday too.
Inshallah. In the summertime, actually, we're planning August 9th to 13th, tentative dates. İstanbul'da düşünüyoruz. Bir TIIP level 1 yaptırmasını düşünüyoruz. Süleymaniye Medresesi'nde inşallah.
Yeah, hocam.
So just look out for this opportunity. Tamamen kesin değil. Yani şimdi pandemik dolayısıyla biraz düşünüyoruz. Aşılı olacak mı? İnsanlar yediğin mi? Nasıl yapacağız? O son kararımızı bu ayın sonunda yapacağız inşallah.
Inshallah, hocam. Thank you for your efforts and your presentation today.
No problem,
I believe that we learned a lot. And I hope that we continue to learn a lot from you. Inshallah. Thank you for your studies.
Likewise. Sağ olsun. Teşekkür ederiz. Hayırlı günler. Selamun Aleyküm.